which will be very different from the international evidence. So our interventions will be very different. We can then have an advocacy group to advocate the screening programs for renal disease in children. That will be very, very important, and that will be very cost effective. I think if you screen 100,000 children and you identify 1,000 children with albuminuria and intervene at that time, that will save a lot of dialysis burden and other problems later on. So I think it is very important that we align our vision in this specialty with the government and other stakeholders and other organizations, and we work together towards screening, early diagnosis, and decreasing the burden of renal disease in pediatric age group and also in the adults. I'm actually, when I think if Tahar invited me, probably she didn't know, but that why I qualify to be one of the guests here. It is because I was the first one when I was Vice Chancellor Shaheed Zulfikar Ali Bhutto Medical University, which is PIMS, Islamabad, and of course Shok and we work together. So that's what I'm saying, we revive the memories whenever we meet each other. We don't have ex-friends, we have old friends. So wherever we leave, we again start our relationship. So, and that's the beauty of Pakistan, that we are so dependent on each other. Tariq is sitting here, who worked with me in Allama Iqbal for 5 years when I was principal here. So that's a treat for me, you know. So what I was saying that when I was there, we started off a pediatric nephrology program. We were the first ones in Pakistan. And when I came to UHS as Vice Chancellor, again I was the first one to initiate a level 4 program of pediatric nephrology in that university, and then I became, that this is how the life is, so unpredictable. We never know what's going to happen, and our Prophet Muhammad sallallahu alaihi wasallam told us that when you say your prayer, think that this is your last prayer. So he highlighted how unsafe. So when I became Pro-Chancellor of Child Health University, Masood Sadiq being the Vice Chancellor there, I was again lucky enough to approve the curriculum of level 4 program for pediatric nephrology in last syndicate meeting. So that's how I am one of the friends of kidneys of children and also protecting them. Also, government have made dialysis free of cost, and especially for children, and also even in the private sector and public sector, because there are now we are saying co-payment system for cardiac disease. If you go to private hospital, you co-pay 30%. But in dialysis and oncology, it is totally free, irrespective of whether you are a rich or poor, because we think dialysis, even the rich people may not be able to afford it after a little while. So Punjab government has taken this initiative of having it totally free. So, and similarly, I think the transplant, fortunately in children, the emphasis is really on prevention of renal disease rather than on treatment. But again, some children, especially with the metabolic disease, they do require transplantation. And again, that is totally free of cost. So transplant medicine should also be part and parcel of pediatric nephrology, because again, it is extremely important to take people off dialysis and encourage them for transplant if they have end-stage renal disease. So that again is extremely important. I think one of the things that we can very simply do is take care of the pyelonephritis. If we obstructive uropathies, things like that can be diagnosed on time, because a large burden it comes from pyelonephritis apart from congenital kidney disease and reflux nephritis. stones, things like that. But I think pyelonephritis is something that, if treated within that time framework as early as possible, can save a lot of kidneys. So at the end, I am again very grateful to all of you being here and supporting the cause of kidney disease in children, because children, 48% of the population of Pakistan, they are very, very precious, because they are the future of Pakistan and they are the main pillars in nation building. And I think this is what I think is jihad, that to save them, to protect them, protect their kidney, so they become very useful leaders, citizens, not only earning for themselves, for their country and society, and then for their family. Thank you so much.
Thank you so much, sir, for your kind words, extending your help and as well as a great concern for the future of the young of this beautiful nation. So now I would request to Professor Noreen Akhtar, who is the chair of the scientific committee, to say vote of thanks to all this session. Professor Noreen Akhtar.
Thank you, Dr. Mimpal. Assalamu alaikum. Honorable Chief Guest, Health Minister Punjab, Professor Dr. Javed Akram, respected Guest of Honor, PPA President Punjab, Dr. Naeem Zafar, PPA Secretary General, Dr. Khalid Shafi, my worthy teachers, Professor Afroz Ramzan, Professor Tahir Masood, Professor Masood Sadeh, our most valued invited guests, ladies and gentlemen, Assalamu alaikum and a very good morning. I feel honored and privileged to get the opportunity to propose a vote of thanks on this occasion. On behalf of the Organizing and Scientific Committee of the 5th Biennial International Pediatric Nephrology Conference, I'd like to extend heartfelt gratitude to the Chief Guest for gracing this occasion despite his busy schedule. We had a great opportunity to hear his inspirational thoughts, which will surely encourage us in future. Thank you for your esteemed presence, sir. It's an immense pleasure for us to have a guest of honor among us as well, for his thought-provoking words are a source of inspiration for us. Their involvement and interest towards this conference is a great support. We are thankful to our distinguished national and international guest speakers for not only sparing their invaluable time for us, but also for enlightening us with their talks on the next few days. We believe we'll profit from your insights and outstanding experience. We express warm appreciation to guest invitees and delegates who have come from different areas to encourage the morale of speakers. We are grateful to the advisory and all other committees and acknowledge the devoted endeavors of all those who are behind the scenes and have worked hard to make this conference happen. They all have striven hard to execute the assigned tasks to extend hospitality to all the guests and the participants. This gathering brings together a large number of people from all over the world, not only to generate new ideas and knowledge, but also to build international relationships. In the end, I'd like to appreciate the efforts of the organizer of this conference, Professor Dr. Iftikhar Ijaz, whose devotion, dedication, and enthusiasm has made this conference happen. Once again, thank you all for being a significant part of the conference.
Thank you so much, ma'am. And now it's the time to say that we just present a souvenir to our chief guest as well as the co-chairperson. So I would